Hi guys, my name is Matt Orinick and I'm going to be talking a little bit about fibromyalgia. So fibromyalgia is a syndrome characterized by chronic widespread pain lasting for greater than 3 months at multiple and often bilateral tender points throughout an individual's body. Individuals that are suffering from fibromyalgia will typically experience pain, stiffness, and tenderness of the muscles, tendons, and joints. However, the painful tissues involved are not accompanied by any signs of inflammation. Therefore, despite potentially disabling somatic pain, patients with fibromyalgia do not develop tissue damage or deformity. After osteoarthritis, fibromyalgia is the second most common rheumatic disorder, which is an umbrella term pertaining to pathologies that may cause chronic and often intermittent pain. Dr. Daniel J. Claw, who currently serves as the director of the Chronic Pain and Fatigue Research Center at the University of Michigan, suggests that the prevalence of fibromyalgia may be as high as 2 to 8% of the population. Dr. Claw reports that fibromyalgia affects more males than females, having a female to male ratio of 2 to 1, similarly to other chronic pain conditions. Moreover, fibromyalgia can develop at any age, including childhood.
Alright, what's up guys? So I'm David and I'm going to be talking about what are the origins or causes of fibromyalgia. So although fibromyalgia is the most commonly encountered chronic widespread pain condition, the etiology and pathogenesis, or the causes and development of the disease, are still not fully understood. In one study, Bellato et al. States that several factors, including dysfunction of the central and autonomic nervous systems, neurotransmitters, hormones, immune system, external stressors, psychiatric aspects, and others seem to be involved in the development of fibromyalgia syndrome. To better explain the causes of fibromyalgia, I will split them up into several categories. Alright, so the first type of cause I want to talk about, the first category, is central nervous system dysfunction. So with regards to the role of the central nervous system in the development of fibromyalgia, central sensitization is considered the main mechanism of chronic pain development. Central sensitization is a condition of the nervous system that is associated with the development and maintenance of chronic pain. When this occurs, the nervous system enters a process called wind-up and gets regulated in a nearly constant state of higher activity. This reaction lowers the threshold for what causes pain and results in the persistence of pain even after an initial injury heals. Central sensitization can be identified by two main characteristics: allodynia and hyperalgesia, which are both associated with a heightened sensitivity to pain and the sensation of touch. The wind-up phenomenon that individuals with fibromyalgia experience is mediated by NMDA receptors, which are specialized receptors for the excitatory neurotransmitter glutamine. That's one of the neurotransmitters we studied at the beginning of the semester. This would suggest that glutamine has a role in the development of the heightened state of neurons present in fibromyalgia. This, along with the release of pro-inflammatory compounds by glial cells and the dysfunction of descending inhibitory pain tracts, leads to the conclusion that the central nervous system contributes to the development of fibromyalgia in multiple ways. So the next one that I want to talk about for categories of the causes of fibromyalgia is genetic factors. So along with dysfunction of the central nervous system, genetic predisposition is likely to be an important factor in the development of fibromyalgia. Family members of patients with fibromyalgia may also present with a history of chronic pain. When compared to individuals without fibromyalgia, first-degree relatives of patients with fibromyalgia are much more likely to have chronic pain states. This is likely due to inherited complications with neurotransmitters, especially the serotonin transporter gene. Serotonin, which is derived from tryptophan, is important in mood regulation and sleep patterns. Any genetic issues with the serotonin transporter, therefore, could account for the association between fibromyalgia and psychological or cognitive disorders. In his clinical review, Dr. Claw states that twin studies suggest that approximately 50% of the risk of developing fibromyalgia and related conditions is genetic, and the other 50% is environmental. So in addition to central nervous system and genetic factors that attribute to the development of fibromyalgia, several other aspects are part of this neurological disease. Other factors that may contribute to the development of fibromyalgia include sleep disorders, autoimmune disease, psychiatric conditions, issues with peripheral tissue, and various other trigger factors such as infection and viruses like HIV.
Hello guys, I'm Prakash and today I'm going to talk about diagnosis of fibromyalgia. According to Dr. Daniel Clow, who currently serves as the director of the Chronic Pain and Fatigue Research Center, states that, contrary to what much research may suggest, the 1990 American College of Rheumatology criteria for fibromyalgia were never intended to be used as strict diagnostic criteria. These criteria, which include an examination of the tender point of an individual's pain, are not currently used in clinical setting. Instead, the patient is asked to fill out self-report survey asking about location of pain as well as the presence and severity of fatigue, sleep disturbances, memory difficulties, headaches, and mood problems. Practitioners often prefer this approach of assessment for fibromyalgia because it does not require the performance of a tender point examinations. Once the self-survey has been taken, an evaluation of the signs and symptoms of fibromyalgia should take place. Musculoskeletal pain is the most prominent of fibromyalgia because pain pathways throughout the body are amplified. However, pain can occur nearly anywhere.
Hi guys, my name is Cole. I'm going to be talking a little bit about the treatment to deal with fibromyalgia. Tricyclic antidepressants are the most common type of drug of choice when treating fibromyalgia. The direct effect of those drugs on norepinephrine and serotonin reuptake results in an approval of sleep, depression, stress, anxiety, inhibition of pain pathways, all of which are associated directly with fibromyalgia. Along with the pharmaceutical approach, physical activity has also been shown to have a positive effect on those with fibromyalgia. Specifically, aquatic or water-based exercises have been shown to make beneficial progress in patients with fibromyalgia and has shown effective for improving pain, mood, fitness, quality of life, and function.
All right, what's going on, guys? So we're here with Caitlin Gallagher. She is the director of the Harbor Creek facility at Pearl & Brown, and we're here to ask her a couple questions about fibromyalgia. So the first question I have for you is, what do you think fibromyalgia is? What's the definition of it to you?
I guess in my opinion, I would, kind of describe it as diffuse musculoskeletal pain. In my opinion, there's a lot going on in the brain too, kind of affecting things as well.
All right, so now that we kind of have a definition established, what do you think the origin or the cause of fibromyalgia is?
Mm-hmm. So I would definitely agree with what the research is saying, that there's definitely something going on, in the brain with these patients. Central sensitization, for sure. One thing that I've found, a lot of these patients have some type of traumatic event that kind of triggered this diffuse musculoskeletal pain. So there may be something linked with post-traumatic stress disorder or something like that.
So our next question is then, when someone comes in, for a regular evaluation, I know you do a bunch of those a day. Mm-hmm. What are kind of some of the signs or the symptoms you're looking for with someone who might have fibromyalgia? Is it a secondary thing in your opinion? Do you use any special tests or anything like that?
Okay. So usually the patient is already coming in with a diagnosis of fibromyalgia, and then they're coming in to see us for low back pain or a knee pain. So we're doing more special tests geared towards the joint that is bothering them the most than trying to diagnose them with fibromyalgia.
Awesome. So continuing on with this, once you do have a diagnosis of fibromyalgia, what's the therapy protocol for them looking like, from modalities to therapeutic exercises and so on?
So a lot of times these patients do well in an aquatic type setting, a therapeutic pool, temperature is warmer. That tends to be where they do best. As far as manual techniques, it's tough for these patients because they have a lot of sensitivity, and maybe their traumatic event had to do with something that is triggered by being touched or something like that. So a lot of hands-off techniques, in my opinion, work well with this patient population.
Absolutely. And then just to wrap it up, do you have any other interesting information or experiences that you've had treating fibromyalgia cases?
I wouldn't peg it as interesting per se, but a lot of times these patients aren't super compliant with physical therapy, which can be frustrating.
Is that just because of the pain levels with them, you think?
The pain levels, and a lot of times they have the mindset that I have this, it's not going to get better, why should I do this? So that becomes an issue with compliance.
All right, well that's it guys, so thank you very much, and I hope you guys learned something.